Do you think the level of telehealth will continue after the crisis passes, or do you expect it to decline?
I think that is a great question. I mean, it is certainly at an incredible level right now in terms of the adoption that we're seeing for telehealth. I mean, when you look at last year, for example, McKinsey did a study in which they asked people what was their interest level in engaging their doctor by telehealth, and only 11% said that they were interested in that venue versus in person. Now you look at that same question today, are you interested in using telehealth to connect with your doctor? 76% of people say that they're interested. That's a huge jump. And that is definitely being affected by what we're seeing with the pandemic. So, you also look at the numbers of cases. I mean, for example, we're a very virtual focused company and do a lot of telehealth. And even with that in mind, our numbers were up. We're seeing 1,000% increase in the number of telehealth video visits that we're doing relative to this time last year. So the spike right now is huge. And so then when you say, okay, well, what's going to happen when this crisis subsides or passes? I think it's definitely going to decline some from where it is right now. There is going to be a tendency to sort of go back to the quote unquote old way of doing things, right? Providers are going to be maybe more eager to see patients back in the clinic. Patients might even gravitate towards that a little bit. But I don't think that we're definitely not going to go back to where we were. And I would say that we really should resist going back at all, because this is a huge opportunity that this has presented. I mean, we have moved virtual care forward, and we know that we can provide a more connected experience, a more better outcomes, and just a more virtual first approach to medicine. And think about the way you bank, for example. You probably engage with your bank mostly through your smartphone or your computer, and occasionally you go into the branch. We're not saying that all in-person care is going to go to virtual, but if you look at the banking analogy, a lot of what you do can be done remotely, and then occasionally with those visits to the brick and mortar. And what I would submit is that this is an opportunity for us to move medicine more into that paradigm, where we're doing a lot of the care virtually, and occasionally bringing patients in for in-person visits when that makes sense.